Coach Don looking good?
I got my full display in the background here for my team meetings.
I see that. I see that. No bragging or anything there.
Oh no. Trust me, all the large trophies are in the Carly's room. I'm not allowed to have them.
How you doing, Dr. Dawson?
I'm fine. How are you guys today?
Good. We're just waiting for some people to hop on.
Hey, sounds good to me.
Good. How you doing, Amber?
I'm good. How are you?
Good. Just gonna give it 30 seconds or so. We have some people logging in now, I see.
Yeah, that's fine. Sounds good. Trying to figure out. I'm in the middle of moving, so I took down all the the shades, so it's so bright in here.
What a great time to move, huh?
Oh my gosh. When we were closing on the house, we were just like fingers crossed it would go through because March 20th, we had no idea what was going to happen. So luckily, now we've got to slowly move in, which is kind of nice. But we thought we would stay in the city and, go to all the restaurants that we hadn't been able to try and stuff. But that obviously has not been able to happen. So
yeah, you can stand outside of them.
yeah.
So Griff and Amber, my assistant, Jason, moved into his house like a few days after the quarantine started. So they had a lot of problems getting their Comcast and everything. The first 2 weeks or so, they had no TV and no internet in this quarantine. Yeah, that was rough.
How many kids do they have?
2.
Oh, that's rough. We were lucky because we got Fios and they came out like a few days after we moved because I was like, we're gonna need internet at least to do our jobs. So
well, Amber, we can go ahead and get started here. Looks like we have about 20 people on the call or so. So obviously we wanted to have yourself and Dr. Dawson on today to just chat with our people a little bit, maybe answer any questions. But it's obviously some different times for us as soccer players and athletes and parents, and just kind of, I guess talk maybe a little bit about some tips to prevent the spread of COVID, some exercise ideas. We've been doing the daily training regimen with our club of live trainings and some stuff that you've sent us. But I think we're facing a lot of different things from a mental standpoint, an emotional standpoint, from an eating standpoint, is the feedback I get from the parents, and just our daily routines have changed. So just want to touch base with the health experts and kind of see what's going on in your world as well.
Sure. Dr. Dawson, do you want to start or do you want me to start talking about coronavirus? You're probably a little more well-versed. You're on mute, Dr. Dawson.
I got it.
There we
You're good now.
Can you hear me now?
Yeah.
Yep.
So, I think like with any other infectious disease, all of the common sense things that we all sometimes forget become very important. Hand hygiene, of course, anytime you're around food, drinking, utensils, we all get very lax about sharing those things, with coworkers, family members, our kids, and really that's not something that we should do. A lot of people have talked about the utility of shaking hands and whether that's a antiquated custom that should even continue in the modern world of infectious diseases. And it's probably something that doesn't need to continue in the future. We probably could assume fist bumps from here on out, even in professional situations. And that's probably just the safest thing. But, just being smart about all the common sense things we should always be doing. In addition to that, we need to be following the social distance guidelines and the quarantine guidelines that are out now, but they do leave some opportunities to still exercise and some opportunities to still become active. And those things are really important, not only to our athletic side, but also to the mental health side, which is very important in a situation like this.
Yeah, I second everything Dr. Dawson said. I think, especially in athletics, like sharing of water bottles and close, containment or close quarters with each other is sometimes tough to get out of that mindset. But hand washing is the best thing that you can do, and following the guidelines that the CDC is putting out about social distancing and staying away if you can is the best thing.
Are you guys seeing, I guess, we've been doing this about a month now. Are you guys seeing a high percentage of youth, I guess getting sick, or is it, across the board, or?
I think from my perspective doing orthopedics, I'm kind of seeing a summer vacation pattern of injuries. Kids aren't in school, so they've got a lot more time to be on trampolines and jungle gyms and, things of that nature. So we're not seeing the sort of sports and organized spring sports that we would usually see causing injuries, but we're seeing the recreational and just out there having fun kind of injuries. From a COVID and infectious disease standpoint, we've been lucky in the state of Maryland. The pediatric cases have been very sparing, as they have kind of been nation and worldwide. Unfortunately, that trend has been going down. There were literally 0 pediatric cases, a month, 6 weeks ago, but now there certainly are documented pediatric cases in almost every state. There are some debates whether there have been pediatric fatalities, but that trend seems to be going up as well. So certainly we need to be careful, although pediatrics doesn't seem to be the most affected group.
Yeah, I've been working in some of the urgent cares and triaging patients and working in our testing tents. And at least for Medstar, our testing positive rate is only about 10%, which is pretty low compared to places like Detroit, which is 30 to 40%. So that's a good thing. Our EDs and our urgent cares haven't been super busy at Medstar. I think people are listening to the social distancing guidelines. They're not going just for random things that they might normally go to the urgent care for. They're staying away. And so that's helping keep the numbers down and helping to take care of the people who really need to be taken care of, who really are sick. So
what would you say, I guess, as far as if you think early on you have the symptoms, should you go right away and get tested, or should you kind of try to self-isolate and medicate? What's the best practice?
So if you don't have a underlying health disease like, asthma, significant diabetes, underlying COPD, emphysema, chronic bronchitis, and you just contract a fever and some, sore throat, general sickness symptoms, you don't need to rush to be tested for COVID-19, because the vast majority of COVID-19 patients have mild symptoms and it passes before they suspect they might have even had it. So if you're a healthy person that doesn't have pre-existing disease, you don't necessarily need to run to the ED to be tested. And that's for two reasons. One, if you don't have COVID-19 and you go to the emergency department, you're likely to be exposed to somebody who does. So if your symptoms weren't severe where you need life-saving measures, there's no reason to go. And two, if you do have COVID-19, but you don't need life-saving measures, you're likely to spread it to other people at the emergency department. So we're encouraging people, if you don't have an underlying disease, you don't have shortness of breath, you're not having difficulty, actually keeping your breath going and maintaining things you need to do at home, then stay at home, hydrate, Tylenol. These are really the best things to just kind of keep you rested and get you better. It's when you start to have shortness of breath or it starts to exacerbate diabetes or asthma or things like that that you need to present to care and you need to do it expediently. But, most people have a mild viral syndrome that passes in a few days. I've had personal experience with several friends and colleagues who have had it. So most people don't experience the things that you see on TV, but it is important if you're at risk to get a test as soon as you can.
Yeah, treat it like you have, the flu, the cold, take you the over-the-counter things, eat your chicken noodle soup, drink your water, stay at home, wash your hands, the normal stuff. There's not anything that the hospitals or the emergency departments can do for you unless you are having trouble breathing and it's more severe symptoms. There isn't any vaccine yet. There's no treatment. So there's nothing that the doctors are going to be able to give you that you can't get on your own.
We're seeing a lot of, obviously it's okay to go out and exercise, but we're seeing a lot of folks still gathering at parks and fields and things like that. What advice do you have for us as far as that? Obviously our club's not getting together and doing things like that, but I think it's more of a group here and a group there, get together out of boredom. Are you guys seeing a lot of that, or?
I am seeing that trend. I think it's not been as much in the state of Maryland. I think the state of Maryland has done a really good job following Governor Hogan's advice. But we do have to be very careful. I've run into people who say they're co-quarantining with other families, where they'll just hang out with one or two families a couple days a week. But you have to remember that's a very risky scenario, because when you go back to your house and that parent goes out to that supermarket and then comes back, there can be a lot of cross-contamination. So that's not something I would recommend. I think participating in drills and sporting events with your family and your siblings is perfectly appropriate. But in regards to other families and other teammates, you really need to adhere to the social distancing guidelines. Now, there's a few ways that I've seen people creatively get around that. Lacrosse players have gotten around it with some long toss between people that will meet at a field and only get within 10 feet of each other. They'll keep the ball at the field so it doesn't go home with anybody, and then they'll just go back to the field and play catch a couple days a week. I think that adheres to guidelines. I've had soccer players do the same thing. Well, they do long kicks across the field to each other, keep the ball at the field so it doesn't get contaminated with somebody's house. That way you can feel free keeping your cleats by the front door. So I think those kind of creative things are appropriate. But certainly having 3 or 4 kids running cone drills in close proximity to each other would not be appropriate. Playing pickup games, whether it be soccer or even just pickup basketball, or other Frisbee type sports in the backyard with multiple families wouldn't be appropriate. So you have to be very careful about cross-contamination, but there are a few ways to get around it and still interact with people following the guidelines.
I've done a lot of talking here. I wanted to open up to the group who I know is mainly listening. They don't have their video on. Did anybody out there have a question they wanted to ask Dr. Dawson or Amber?
It doesn't have to be about coronavirus either. If you want to ask a question about staying healthy, if your knee is bothering you, anything, we're open to answering any questions.
I do have a quick question while maybe a few are thinking about their questions. So as far as, let's say, and I know this isn't true yet, but let's say next week we're able to go outside, which I know is further away. But when we do get the all clear to go and participate again, even though we've been training at home and things like that, what type of injuries do you see happening for athletes after being somewhat inactive or, only active in a smaller space when maybe they're in more of a distance sport? what type of injuries or things should we look for or to keep an eye on?
Well, we're going to have to be very watchful for overuse injuries that can occur quickly because athletes haven't been at their normal level of activity. So I'm strongly recommending a gradual return to play in a common sense fashion that would involve practice and games and tournaments not at the same frequency that you would normally be having this time of year. And I think that's going to be essential to keeping athletes of this age safe, because we have to remember their development is still going on. Their skeletons are not mature. We're still dealing with growth plates, and these are all areas that are vulnerable. So if we just go back into 100 miles an hour, 4-game tournaments on the first weekend, then it's likely that we will see some soft tissue injuries. We will see, Achilles tendonitis pop up, patellar tendonitis pop up. The things that would probably take several weeks to occur during a normal season may occur in a couple days if we try to go back too quickly. So it's going to be very important that everybody's following warm up and cool down procedures when we get back to activity, icing down all their joints, even if you don't have an injury, kind of like the professional and college level do. And then, it's going to be important for us as the adults to make sure that we are sticking to a common sense schedule that has the musculoskeletal health of the athlete in mind, not necessarily how quickly can we ramp up to our normal frequency, because it's not a normal situation, and we want to make sure that we have a lot of kids on the field for a long term, not just for the first 2 weekends.
Yeah, so we're going to come up with some acclimatization guidelines. There's a lot of research that's out there for football going back in August, like at the hottest part of the year. So how do you acclimate to that? Because that's going to be another issue is not only have you not been training, it's going to be warmer when we're finally back out there. So you're going to be deconditioned from that part too. So it's not just the soft tissue injuries, it's also heat illnesses and heat exhaustion, heat stroke. So you want to make sure that you're not, at higher risk. You're already going to be at higher risk. So how do you minimize that? Like Dr. Dawson said, tendonitis, shin splints, things. If you're going from different surfaces, you've been playing like at a park or on hard surface and now you're going to a grass surface, or you were using grass at home and now you're going to a turf surface, all that stuff changes. So shin splints, stress injuries with the bones, and tendonitis. And for soccer players, like hip flexor and groin injuries, because you haven't really been kicking long balls, you haven't been taking really hard shots, you've been maybe passing and dribbling and doing small work, but you haven't been hitting those big shots. So that's going to be important, is to slowly build up and not just go out there day one and work on corner kicks, because you're going to have a lot of people who have hip flexor and groin strains.
Very, very, very good point.
So Amber and Dr. Dawson, would you recommend, I guess, some exercises, or maybe you could send to us during this period of like the strengthening the hip flexors or something, or would you recommend doing that or no?
Yeah.
Absolutely. It's a good idea in the off season at any point to, keep the muscles useful to your sport condition. So that's certainly something that we can do for you. And I know Amber was already working on something to that end. But, all of those things are really important to make sure that we keep the athletes as healthy as we can, for long term. And from the athlete perspective, they have to realize they need to be patient. They're not exactly at the same point they were when all of this started as far as their cardiovascular fitness. But the other thing that happens with child and adolescent athletes is your body is completely different every single season. And you've had growth spurts and weight gain and different changes in maturity levels. So that may very well be the case, the difference between March and June when this may start up. So everybody just has to realize there's going to be a little bit of patience involved with your fitness level, your coordination level, but everything will return back to our baselines.
Yeah, we already, I'll send you this, Mike. We have finished editing some band workout videos. There's a couple different ones, and all your kids have the bands, so it's easy for them to do at home, to work on some of that core and hip strength.
Very good. Don, I know Don Keener had a question. One second, let me unmute him. There you go, Coach Don.
Yeah. So what would you say for parents that are worried about taking their kid to an orthopedic office, doctor's office, to get their child looked at? Because at this downtime, this is probably a time you could deal with some nagging injuries or at least have them addressed. But parents are concerned about exposing our kids to coronavirus or whatever?
That is something that we're dealing with right now, and I feel very strongly that if it's not a broken bone or a new kind of severe acute injury, now's not the greatest time to be cleaning up your kind of list of overuse injuries. You know, today I was in the office prior to this call, and it was strictly just for a couple little kids, like I said, that have had those summer vacation injuries where they've fallen and broken bones. I don't want to risk being at the office. I don't want my assistant to risk being at the office. I don't want patients to risk being at the office, because if you're there to see me, you're also going to be in the waiting room with a 60-year-old who's following up from their hip surgery 2 months ago, and, you know, several other demographics. So in my opinion, sports medicine and orthopedic has to be very humble at this point and understand our general order of medical importance. And, you know, right now, if it's not acute fracture care, I think we all need to be following those guidelines of staying home, you know, RICE, rest, ice, compression, elevation. We can all follow those guidelines. And if you have a chronic injury that's been nagging you, rest is always a good thing. And now we have the opportunity to do that. But I think you bring up a very good point, that the risk of exposure right now should really be taken more seriously, unless it's an acute injury that needs to be reset or things of that nature.
Yeah, so a couple things to add. I mean, Medstar has canceled all elective surgeries, meaning you have a torn rotator cuff, you tore your ACL in your knee. None of those surgeries are happening unless there's some sort of concomitant serious, like you don't have feeling in your arm, so now you have to have surgery. But that doesn't mean that there aren't things you can be doing. Like if you do tear your ACL, there are definitely things you can work on in the meantime before you see the orthopedic doctor. So if somebody has an issue, I encourage them to reach out to me. We're trying to start up virtual injury clinics. So you can do an appointment with a physical therapist free of charge for the union families, where you can get some advice from our physical therapist about specific exercises, specific strengthening, stretching protocols that you could do or your kids could do. So we can help set that up. So there are some other ways to get medical information without actually going into the office.
Absolutely, absolutely. I mean, my office actually has electronic visits too. I've been doing that all day, very similar to this platform. So if you do have an injury you want to discuss that's been going on chronically, please call the office and they can schedule you for what's called an e-visit, and I can see you just like this. You can show me your knee or your ankle, and I can look at it and watch it jump around, run in place, all that kind of stuff, and make a decision. So we certainly can do things electronically. I don't want to suggest at all that we don't want to interface with patients during this time, because we absolutely do, but we also want to make sure we're keeping everybody safe. So, you know, if you fall off your trampoline and your ankle's pointed the wrong way, absolutely, I'll see you in the office today, you know, but if your ankle's been sore for the last 8 months, much better for us to talk about it over video.
Yeah, a lot of sports medicine can be done via history questions and asking the right things to figure out what's happening, not necessarily touching the person.
Very good. And any other questions out there from the group? Thanks, Coach Don, for that one. Oh, somebody sent one via the chat here. Let me read. So what do you think are some good and fairly active activities to keep kids, or I'm sorry, fairly safe activities to keep kids active?
That person just said to running. Always. You can definitely go out and do running for sure, walking with your family, rollerblading if you have rollerblades laying around, bicycling. All of those activities are fine as long as you're not holding hands while you're bicycling with the person next to you. Same thing if you're running, you know, not be right next to the person next to you, keep your distance, but all of those things are totally fine. Playing with your family, like playing outside, just making up games and letting them just run around in the yard is totally fine. They're discouraging the use of like jungle gyms and like if you go to the park and play on the gym, trampolines. But if it's your swing set at your house and stuff, that's okay. But don't go to the big park nearby and play on all the equipment there. But there's lots of things you can do at your house. Like if you have a staircase, running up and down the stairs or using the stairs in a creative way. There's lots of things around the house. Just we've been painting at our new house, picking up a can of paint and doing something with that, or picking up a gallon of, you know, your laundry detergent and using that. There's lots of things you can do around the house. You just got to be a little bit more creative about what you're doing, I think. And there's no reason you can't be active or you can't be doing things, especially in your own yard and safe in space.
She brings up a great point. I mean, it's a great opportunity for everybody to be cross-training. We all spend a lot of time specializing and subspecializing in a sport or even a specific position within the sport. And now is a great time to kind of break that mold, maintain your cardiovascular health by doing some other things. You know, if you used to do Taekwondo a couple years ago, you know, now's a good time to start practicing those forms again, or start practicing kicks again. Or if you used to play another sport besides soccer, you know, throw that ball around, you know, because sometimes we do get in trouble by doing one sport 12 months a year because certain muscle systems start to break down. And right now we have a great opportunity to get your body moving by doing some different things. So like Amber said, get creative with things around the house, get creative with different games and activities and sports, you know, try to stay away from common pieces of equipment that could contain, you know, cross-contamination, and, you know, try to stay away from things that could end up keeping you out of your sport when things come back online. So, you know, if you're looking to be back in soccer, you probably don't want to break your ankle on the trampoline or, you know, riding somebody's hoverboard right now. So stay active, stay creative, but you do want to keep in mind that you don't want to suffer any injury that could keep you out when we do go back online.
Yeah, jump rope is a great thing to be doing if you have a jump rope lying around. Hula hooping is good. Just like the random stuff that maybe your kids haven't played with for a while, time to bring those things out again. And practice something different. New types of exercises. Yeah. So it's about like just getting a little creative. Body weight. I love that you guys are doing these yoga sessions. Yoga is great for all sports. Working on your flexibility. It also helps. It works on your breathing, so it helps your mental state. Calm you down a little bit. Focus your energy a little bit. So I think all the kids should do the yoga stuff. There's a lot of fun poses that they do for kids and different stuff. I think utilizing yourself as a family, how can you guys all be doing something? How can you play a game all together? Scavenger hunts around your house where you hide things, and like an Easter egg hunt, but now you got to do something different. People have been doing obstacle courses around their house where, you know, you draw chalk outside and you have to tandem walk on the part of the chalk, and then you're jumping at a certain part and doing different activities. So it's just about getting a little more creative than just letting kids play. Like back to the days when we just went outside and then your parents called you at 6 p.m. and said, dinner's ready. I think that's kind of what we need to go for right now. Don't play with the neighbors though.
This question is for the doctor from one of our dads in the group, who asked if you could let his wife know that you can catch the COVID by mowing the lawn.
Well, if you're riding on the lawnmower with your neighbor, you know, there's a good chance that might happen. But I would like to extend that to you can catch COVID from getting up with your toddler in the middle of the night and paying the mortgage.
Do we have any last questions out there? We're coming up on about 30 minutes. I want to be respectful of Amber and the doctor's time. Did anybody want to add one last question? Nope, looks like we're good. I want to thank you, Dr. Dawson, for your time, and Amber. I mean, I wrote down a couple notes for myself here, just for the club, but as well as my children. You know, it was very insightful, and we really appreciate your time and the relationship that we have. You know, our partnership that we have. It's been awesome.
You're very, very welcome. We appreciate, you know, all the hard work you guys put into your organization. It definitely shows. We want to stress again that we are still accessible during this time. Our offices are open, so if you call and need to get in contact with us, we certainly can. And if you need to schedule a e-visit, we can certainly get that done as well. So don't think we're not here. We're still working every day. I've been doing electronic visits and office visits today. Amber's still here for you guys too. So everybody stay safe, and we're here to help in any way that we can.
Outstanding. Thank you, guys. Appreciate it.
You're welcome. Bye-bye.
Good
Thank you.
day.